Your milk production depends on how frequently and how well your baby breastfeeds. Your baby's sucking sends a message to your brain. Your brain then tells your breast to release milk so your baby can take what he needs. The more frequently your baby eats and the more milk he removes, the more milk your breasts will produce.
Cindy, I may have related to you my experience as relative to breastfeeding. My oldest grandson was 1.5 years old when they decided to do a tongue tie release on him. It was a big discussion between myself and the parents and our friends who were pediatricians and pedodontists. And he was 1.5 years old. He was taken to a local hospital. It was half a day in the hospital, general anesthesia with 15 family members hanging around. Now, I just showed you a video of Archer, and it took us moments to take care of his problem. You know, people ask me what are the long-term problems relative to breastfeeding and a tongue tie. I said, well, problems I want to know is what happens with tongue tie. I said, well, if you have a tongue tie that's not released, it's difficult to breastfeed. There could be potential speech problems. There could be potential spacing problems and orthodontic problems, because if the tongue can't raise up to the palate, the upper arch can't expand, and you can end up with crossbite relationships. But for your new moms who have a problem, I met with a lactation consultant after the very first case I did, and I learned about the discomfort, the problems that moms have. She showed me photographs, and they can get beat up pretty badly by the infant trying to nurse.
Absolutely.
It's my understanding that you don't get all the support that you need from pediatricians relative to this. Is that right?
That's true. Many times the anterior ones are so evident. I mean, they're easy to pick up.
Right.
But a lot of doctors, if they don't see that thin piece of skin right from the tip of the tongue, they are a little hesitant to believe that there is such a thing as a posterior tongue tie. And the posterior tongue ties, I think, many times cause more problems for mothers because it isn't so evident, and
right.
It takes a lot more to pick one up than it does the very thin skin that goes from the tip of the tongue, a heart-shaped tongue. The posterior ones are a little more subtle, and many times it's even the second day that the mother is in the hospital with the baby, that if the baby is not sustaining a latch and mother is still complaining about pain, that's when I really do a digital exam and
right.
really look very carefully, because quite often it is a posterior tongue tie.
Well, I would say that the majority of the patients I see who are infants come from lactation consultants like yourself, and I do the digital and visual exam, and I say, well, what did Cindy tell you? And sometimes I'll find a frenum on the top, rarely on the bottom, that interferes. And we treat these patients, and we took care of Archer today.
Yes.
And what we do is, with an infant, we can treat them without anesthesia, we can treat them without a scalpel, we can treat them without stitches, no pain. With the laser, there's no bleeding. I do tell the moms that they have to exercise, they have to put the finger underneath their child's tongue about 6 times a day for the next couple of weeks, so there is no reattachment. If it was an older child, I would tell them to stick their tongue out at their siblings several times a day, and that's easy. You know, if this is left until the child gets older, then it's a bigger procedure. It's numbing it, many times it's stitches, and it could be uncomfortable. So certainly I would endorse what you're doing to get them taken care of, not only for the benefits of nursing, but for stopping a more invasive procedure, more involved procedure later on. But we treat young children, we treat old children. I treat adults who have the same problem. I treated a gentleman who was an attorney, who was a member of our family, said that every time he spoke, he would catch his tongue on his lower front teeth and he would be sore. And it's a terrific procedure.
Your milk changes according to what your baby needs. If your baby is born prematurely, your milk provides the extra nutrition he needs to catch up. If you or your baby are exposed to a virus, your milk supplies antibodies to protect your baby. No other substance is more perfect for your baby than your milk.